there were some things that got left both incomplete or not completed, and as we found out during the exam yesterday, confused. And so I wanted to appreciate Dr. Arndell for the extra time to go over some of the material just to make sure things are right. And because the whole point of this course is to make sure that you enter medical school absolutely on top of some of the very core essential concepts and the core functions, 10 essential services. So that's what I wanted to go forward on. Just to recap, remember 1988, the book Future of Public Health, drafted by the then elite of public health, determined that public health was nationally in a state of disarray. And that was based on the wide diversity and inconsistencies across multiple state and local health departments, and a lack of connection between federal initiatives and programs, state programs, and then all the things that were outside of that system. And so the same group of people convened, and over the next few years determined, after a lot of research, that there were three core functions, of which assessment, assurance, policy development. You may have learned these in the handout in a different order. It really doesn't make any difference. These are the functions, and as I think you understand, they tie back to the 10 essential services. Some of you have asked me, why 10? Historically, 10 has proven to be an important number to have on lists. The citations for that, Moses, tablets 1 and 2. Hippocrates, in some of his writings, also affirmed that in the health context, 10 was important. U.S. Constitution, first 10 amendments, called the Bill of Rights, 10. And that's brought up to present day, where it's been pretty much codified by David Letterman. So they determined 10, and here they are. They had to kind of do some juggling, and the reason for really trying to get this straight, you remember the circle with the core functions and aligning these with the 10. And as we found out, I guess they don't consistently align, and there's some exceptions where some of these 10 essential services are actually covered by more than one core function. And that's what I'd really like to get down to. So I wanted to, you have in your handout the 10 essential services.
Oh, this is so boring.
God, yeah.
I can't believe how boring this is.
Whoa.
Hey, I thought it stories about the babies drowning in the
I'm the
river.
professor. I'm the professor. Who are you?
Oh, yeah, the diarrhea. I know. Sorry about that and the heart attack.
Grandpa, save us, please.
I mean, stories, please, stories. I know. Even Lisa was
You want to hear the story?
Yeah. Hey, Grandma, you kind of set the arthritis or what?
Okay. Are you kids ready?
We're ready.
We're ready. Yeah.
We're ready.
Okay. Let's hear some stories here. Once upon a time, the people living in a village by a river began noticing bodies floating downstream. At first, they were mostly babies floating by. Then older people, then all kinds of young and middle-aged adults started showing up, floating down the river. One of the townspeople was assigned the job of diving in and rescuing them. As the days went on, more and more people started showing up in the river, and some were drowning. The rescuer called others to help him, and after a while, a huge crowd of townspeople were spending most of their days and nights jumping in the river and pulling out the drowning people. The problem got worse and worse, and everyone was exhausted until one day, one of the townspeople just stopped and turned around and started walking upstream. All the others began yelling at him in amazement and outrage. "Hey, where are you going? What do you think you're doing?" He yelled back over his shoulder, "I'm going upstream to find out how all these people ended up in the river."
And what did he find upstream?
Well, some people were trying to cross the river on a bridge, but the bridge had a big hole in it and people were falling through.
And those people who lived really close, they had to live really close to the riverbank, and when it flooded, they just got washed away.
And some people got pushed in.
Oh, God. And then some people, they were so sad, they just kind of jumped in themselves.
Ugh.
It was sad.
And the people in the town still sing the song.
All right.
So are you ready for a song?
Oh, it's
We want everybody to sing along with us.
You'll
here.
recognize the tune, and we could use the help singing.
Yeah, we could.
In more ways than one.
When you are
Poor and the flood's at the door, you know you'll probably go downstream.
bodies afloat,
Cause the bridges are broken, so you're sure to go downstream. Us people down the river will try valiantly to rescue the bodies floating down the stream. We know it's what we must do, but we are tired. The bodies keep floating down. There are so many more daily, and more of them drown. So we go upstream. That's where the problems are. Upstream, prevention is not too far. Upstream, the answers are waiting for us. Upstream,
Very nice. But what do you think all of this means?
Well, one thing it means is if there's a problem, you should find out what's causing it. Otherwise, you can't fix it right.
Excellent.
Hey, but now, can you tell us about the twinsies? You know, those two twins you talk about all the
The
time?
story about the twins. Okay, here we go. Many years ago, at the turn of the century, there were two babies born in Upstream Town. Twins named Sister Public Health and Brother Planning. Like many twins, they were very attuned to each other's needs, and they were very loyal to each other. When they were quite young, Sister Public Health became deathly ill with diarrhea and wasn't expected to live. But Brother Planning could not stand the thought of life without his sister, and in the tradition of any self-respecting young child, began asking questions of everyone he could find. Why is she sick?
because she has a bad infection.
Why does she have a bad infection?
Because she drank dirty water.
Why did she drink dirty water?
Because there are no bathrooms and all the sewage runs out to the street where the water is.
Why doesn't somebody do something about that?
And at that point in the questioning, all the adults would get frustrated and just turn around and walk away. So Brother Planning decided he'd just have to do something about it himself so that other children would not have to watch their siblings suffer. He carefully took out his blocks and tinker toys and began designing a neighborhood with healthy housing and clean water and sewage systems and all manner of wonderful things. His sister Public Health survived thanks to the help of some nice nurses who came to visit her and took care of her while she was sick. And once she was well, she was overjoyed that all her other brothers and sisters and friends didn't get sick like her due to the wonderful inventions of her Brother Planning.
As the twins grew older, they began working together on other projects to save their friends and families from the suffering caused by infections that are spread when people don't have clean, healthy places to live or to work. During the Great Depression, they even took a trip to New Mexico, where they were able to use money from the government.
Stimulus.
Actually, this was a special program called WPA to help wipe out malaria in Rio Arriba, Mora, Santa Fe, Sierra, and Doña Ana counties by draining the swampy lands along the Rio Grande to make them suitable for farming and not suitable for mosquitoes. They had great fun with that project, but they were even more excited, given Sister Public Health's own childhood diarrhea experience,
That word again.
when they got to help with the WPA Sanitary Privy Project. that built thousands and thousands of healthy outhouses to improve the sanitation in thousands of homes, that prevented many children from dying from diarrhea caused by infections.
Sister Public Health and Brother Planning had lots of fun doing other things like designing better roads so that people wouldn't die in accidents so much and things like that. But then, as often happens with siblings, they started growing apart. They didn't hang out together as much, and they each started developing their own interests. Sister Public Health got really fascinated with the new wonders of medicine, things like antibiotics and vaccines. Now as she grew older, it seemed like there were less and less of those pesky infectious diseases killing people. But she noticed that there were a lot more people who were sick from things they didn't actually catch from other people. And once they got sick, it lasted a long time, sometimes the rest of their whole life. So even if people were living longer, they were living sicker.
They call those chronic diseases.
Chronic.
Yeah. So Sister Public Health started trying to figure out ways to convince people that they needed to change their behaviors so they wouldn't get sick.
Like eating fruits and vegetables and getting lots of exercise.
You mean physical activity?
Yes, it all made perfect sense to Sister Public Health. But one day she followed some of the sick people home and realized that they couldn't eat the good food she kept telling them to eat because they didn't have enough money. And instead of grocery stores, their neighborhood was filled with McDonald's and Allsup's mini marts. And she also noticed when she followed them home that the neighborhood was run down and dreary with not a park in sight and no kids out playing. And she almost got hit by the speeding cars since there was no sidewalk, and it made her never want to walk there again. And even though Sister Public Health did manage to help some people, more and more kept knocking on her door every day, showing up with diseases like diabetes and dropping dead from heart attacks right there on her doorstep. She thought she just needed to work harder to change people's behavior, but the problems just kept getting worse.
And then she noticed they got worser and worser the less money people had.
That's right. She was very frustrated and sad. But it didn't occur to her to go ask her twin brother Planning for help, since he had meanwhile become quite enamored of superhighways and fancy housing developments with shopping malls out in the suburbs. He was so busy and making so much money that he didn't have time to think about his Sister Public Health or really care much about what was making her so sad.
Yeah, but fortunately the story doesn't end there.
That's good.
Really good.
Yeah, because we need something else besides
The
this stuff.
twins got invited to a family reunion being held by their cousin Policy, where their grandmother Great Streets reminisced about how much healthier and happier people had been in those old neighborhoods before the fancy suburbs that Brother Planning had helped design. When kids could walk or ride their bikes to school, and people traded odd jobs for fresh fruits and vegetables, and the families could eat together almost every night because the moms and dads didn't have to work 2 jobs each to make enough money to pay the rent. Grandma Great Streets got pretty choked up remembering all this. So after some more nostalgic moments over a nice bottle of wine at dinner, a nice non-alcoholic wine at dinner, of course.
Yeah,
Sister Public Health and Brother Planning suddenly realized how much they missed each other and how powerful they felt as a team when they were young. They got so excited about the possibilities that they started working together again, thinking about how things were done in upstream town.
Yeah, you know, like people of all colors of the rainbow getting together and making sure they had a happy neighborhood.
And parks to play in.
Oh yeah, parks to play in, and everybody got educated, even the babies, I think.
And good jobs for the mommies and daddies.
Yes. And even though it was really hard work, they decided to build themselves a new house together in that little upstream town where they were born, bringing new joy and hope back into their lives and the lives of all they touched. So what is the moral of the story?
Well, not everybody has what they need to be healthy. So if you want to know more about them, you should probably follow them home and see where they live.
Very
And that Sister Public Health and Brother Planning really needed to get back together because they did their best work together.
And it's even better when their cousin policy helps out.
Oh, very, very good. You're really learning this stuff.
I know this stuff. Yeah.
And you remember too that they were so inspired by working together again that they began writing little songs to express their feelings.
That's the word.
The
songs. More
The
songs.
songs.
Come on, Uncle Ron.
Okay, Uncle Ron, we need your help. Okay.
Just happen
Yes.
to have my guitar handy.
Oh, are some of our other neighbors
Sorry,
here? Oh, there's little Dr. Christine. Oh, and Dr. Jamal Martin. Oh my goodness. And Alex, that fashionable neighbor of ours. We love that Alex. We need a lot of help with these next songs, and everybody will know the tune.
Come on, Lisa.
This first one is by Sister Public Health about all her favorite things, like those 10 essential services of public health.
And Dr.
Favorite.
Weiss is gonna let us know which one's which. Are we ready?
He's gonna keep us on track,
Okay,
right?
ready?
Monitor status, who's sick and who's healthy. Look at the difference between poor folks and wealthy. Find all the hazards, investigate risks. Let people know what is making them sick. Why do some people live longer than others? Work with them closely, see what you discover. Mobilize partnerships, work hand in hand. Make some new policy, change all the bad. Make sure the laws and the regs will protect us. Link up the people with care that they can trust. Public health workforce and make sure they're paid. And that the services do what they say. Find the new insights, learn new ways of thinking, cutting edge answers to questions we're linking. Improve the system with what we have learned. These are essentials of public health work. When disease hits populations, makes us feel so sad. We simply remember how public health works, and then we don't feel so bad.
We love that song about Sister Public Health's favorite things.
Yeah.
And we also love the song that Brother Planning wrote about places and planning.
Right.
Uncle Ron's
We
band.
want everybody to sing along with this one.
Yeah.
And I really want to hear some harmony this time.
Okay, Grandpa.
You don't even have to hold
Hey.
hands. Just harmony. What's that?
Okay, whenever you're ready, Brother
I'm almost
Ron.
ready here.
Almost ready. Okay, one more finger. All right.
Amazing place, how sweet the song. Our neighborhood is great. We once were sick, but now we're strong. Our homes and streets are safe. I once would serve good food to eat, to help my
planning song. Well, they also like singing duets, especially in smoke-free coffee houses.
Only in smoke-free coffee houses. Okay, are y'all ready?
Everybody
back
can
in
help
time
with
here.
this one.
We ready?
We're ready.
When some are healthier than others,
Perhaps the charts are what we see. Numbers on the page, disparity. But when we notice it's not right, they're dying young 'cause they're not white, then it's just not fair. Inequity, disparity, inequity, inequity, disparity. Yes, there is a difference, can't you see? If we choose to treat the illness, but we just ignore the cause, thinking it will change disparity, others will continue dying, poverty will take its toll. That is just not fair. Inequity, inequity, don't let it be, let it be equity. We can make a difference, can't you see? Let it be equity, let it be equity. We can make it happen, equity.
My goodness, that was a lot of fun. Yeah, very well done. It was a lot of fun and a lot of words. So, what do you think it all means?
That it's really important to be fair for everybody.
And for everybody to be healthy, we need lots and lots of people to help.
And everybody needs good food close by. Not just some people and not just Burger Kings.
And everybody deserves to live in a nice neighborhood where they can take walks without getting hit by cars.
Yeah, and we can't do anything just to do something.
That's great, kids. Why don't we ask the professor who was speaking before if he would like to help us understand some of this?
He's got a coat
What
on.
does our Mr. Professor Bill Weiss think?
Dr. Mr. Professor?
I think this is terrific, and I just want to interrupt to do some acknowledgement. Marsha McMurray-Avila, singer, songwriter, composer.
All-round good person.
We premiered this performance at the New Mexico Public Health Association, where she is the executive director, at its annual meeting this past, was it April?
Yeah.
Yeah. so-
How many of you are members?
Ooh.
Uh,
Yeah.
Today.
And we have a great bunch of people who are working on these issues specifically. And I'd like to also introduce Christine Swotze, who is the executive director for the New Mexico Health Equities Working Group, of which, who are members? All right, so this is a working group that is actually trying to change and reframe the issues of what health is, how it's described, and how we approach policy to put some of the fundamental social inequities back on the table so that they can be addressed and so that we can get the kinds of policies that are going to make a difference